I hope everybody joins in very early so that we can start answering the questions, because otherwise a lot of questions go unanswered because there are so many questions and we cannot finish on time. Before the question starts, let us first start with one of the case. Now this is a very interesting case of a female that came to me. I want to tell you the importance of rubric, importance of symptoms sometimes are so important in homeopathy that if your case taking is good, if you have taken a very good case, if you have taken a very important symptom, and that symptom could be the entry point and the symptom of the case. I had a case where the patient was suffering from lot of eruptions around the vaginal area. She had taken allopathy medicines, but there was no results. Only till she took the medicines, she was better. Afterward, what happens that the eruptions were increasing and the eruptions were all everywhere in the pelvic area, and she was taking a lot of medicines which could only relieve the complaints. She came to me. We also took the whole case, and the case we took, she was better again with the medicines, but not completely cured. In the whole case taking, we found out that one symptom was very particular that the patient told me, whenever I have white discharge, whenever I have leukorrhea, I start getting the eruptions. It was there before, but the gravity in which the patient told the symptom during case taking was not so important, we found. That's why I prescribed her Muxol, I prescribed the sulfur, but only temporary relief. When she specifically told that, sir, whenever I have leukorrhea, I get these eruptions around this area. And when I repeatized that case, I took that rubric in female, eruptions from leukorrhea. And to my surprise, the only medicine in that rubric was phosphorus. I prescribed the patient phosphorus 30 and after 1 week phosphorus 200 and called the patient after 20 days, 3 weeks. It was a fantastic result. To my surprise, the patient was 80% better within 20 days. With that one symptom of eruptions in females from leukorrhea, and the patient within 2 months was totally relieved and cured with the problems of eruption, which she was suffering from at least 2 years. This is the importance of understanding the symptom and the importance of the understanding the gravity of symptom. Sometimes, patient does not feel the importance of symptoms. She says, okay, I had this eruption. Sometimes it happens, after physical contact also. And she just takes the symptoms very casually. So we also take the symptom very casually. Understand with which gravity, with what gravity the patient is narrating the symptom, because that will basically tell you the entry point of the case. I hope you have got some inputs of this case, and of course the case was very long, but I could just finish that in this. So welcome Dr. Nilesh Jain, Dr. Bipin, Dr. Nilesh, Tony. Yeah, hello Tony, after a long time. Nitin, Disha, Bipin, Darula. Yeah. So I'll just take the symptom, the questions first. Nilesh Jain says, well selected remedy fails. Okay. Anxiety, overthinking, homeopathy medicines and mother tincture. I have told you before also, anxiety is basically not a symptom. It is basically a state where the patient is suffering from because of some internal turmoil. First of all, you must understand why the patient is anxious. There may be hundreds of medicine for anxiety. For example, I'll tell you, anxiety, for example, maybe in the bed, anxiety because of asthma, anxiety because of business cares, anxiety sometimes causeless, anxiety sometimes because of children, anxiety because of household matters. There are so many symptoms in relation to anxiety. Try to define the symptom first. For example, I'll tell you a case that had come to me, and the patient said that she was very anxious. So we took the case and I found nothing in the anxiety, and I asked the husband also, what is the anxiety? And the lady told, don't ask my husband. I have anxiety without any cause also. And so I just prescribed because of one symptom and 1 or 2 symptoms we added, and I prescribed the patient single dose of Bryonia, 1 ml in water, and that took off the case, and the patient is totally better now. So you have to define the symptom of anxiety. That is very, very important. No? Mother tincture for anxiety I have never prescribed, my dear friend. So I cannot tell you about mother tincture, but this is a case. So if you define that symptom, if you tell proper symptom to me, I'll be able to answer it better. Can Nux Mosca be taken 200 daily for drowsiness? Yes, you can take Nux 200 daily, 200 not daily, sorry, I don't prescribe daily. Once a week, then see how the patient follows up, and then you can repeat 1 potency. If you want to prescribe daily, sorry, give an LM potency. Good afternoon, Dr. Disha. इंसोमिनिया की बेस्ट मेडिसिन विपिन, वैसे तो सभी दवाई जो कॉन्स्टिट्यूशनल मेडिसिन है बेस्ट है, बट इंसोमिनिया की कुछ दवाई है आपने, यू मस्ट हैव सीन इंसोमिनिया पैसिफ्लोर मदर टिंचर. If you see boric metermedica, if you have boric metermedica, open that. It is boric metermedica. The dose is very important. In passiflora, it is taken as 30 drops. Normally, if I get a case of insomnia and it is not responding to treatment, I give passiflora mother tincture 30 drops at 7 o'clock, 8 o'clock, and 9 o'clock. And the patient gets wonderful sleep at 10 o'clock because I give 3 doses, 1 hour gap, 30 drops. The other medicine you can think about is Califos in trichuration. The other medicine you can think about is Pisidia, Piscida. सर आप मुंबई कब आने वाले हैं? अनीसा शेख. October 1st Sunday. Constitutional medicine equally effective in globules? Yes, definitely. Why not? It is effective. So Anisa, you can take my WhatsApp number 9011303171. Take the appointment and then we can talk further. Lux Moscato 30 can be taken daily. Nitin, I am not a doctor. Prescribe the medicines so many times daily. If you want to prescribe daily, please give LM potency. Okay, I am not a doctor who prescribes daily either 30, 200 or 1M or 6 potency. If you want to prescribe daily, please give LM potency. Okay, so I was telling something about anxiety. So there is a wonderful rubric, you know, if you have seen the rapid treat, there is a wonderful rubric. Anxiety causeless, Bipin. Anxiety causeless. Think about bryonia, think about phosphorus, think about Hiparsulf. These are the remedies where the patient is anxious for no cause. Okay, so this is anxiety causeless. Let us go forward. So sometimes, you know, patient comes to us and say, Doctor Sir, there's a lot of ghabra, there's a lot of palpitation. I think what will happen in my chest, what will happen, I've got heart problem, what problem, there's so much anxiety in the chest. So you ask the patient, when there is anxiety, what do you do? And then the patient says, whenever anxiety, there is no, I just go out in the open air. Whenever there is anxiety, I cannot sit at one place, I have to just keep moving. Or when there is anxiety, I just keep eating. Or whenever there is anxiety, you know, I like playing piano, but I cannot play the music and the piano. So try to define the anxiety. Anxiety is a very broader state of mind. Try to define it, because anxiety, everybody passes through this stage of anxiety. It depends on which symptom you have taken for prescription. Hello, are you with me? I'm a bit fast, but then this is very important. What can be given for a dengue positive child? See, dengue, don't go for the diagnosis that the patient has dengue and the patient has chikungunya. What will happen? Lot of cases, n number of cases I have depend what is the presenting symptom? How did the disease start? What was the first symptom the patient suffers from? For example, the patient had lot of pain in the body. That is a presenting symptom. Which part of the body? In the knees, in the thighs, in the elbows, or the patient has generalized malaise, or the patient had malignant type of weakness, could not do anything, just lies listless. I had an interesting case of dengue of a person of 45 years of age. He was a businessman. His wife came to me and said, Doctor, he has so much fever and lot of cough. We have given him crocin, but he does not want to go to the factory. He is just lying down. He does not want to eat. He does not want to talk to his children. He just still just give me anything, give me whatever you want, and just lying down. I prescribe a single dose of acid phos 1 ml in water, 3 doses. Believe me, in 8 hours, the patient was up about his feet, going to his factory. Of course, the cough and malaise was there, but this is the change we want. So first of all, see what is the presenting symptom the body is trying to tell us, and then try to prescribe. Okay? Fever spikes to 102, some rashes. Yeah, then you can see if the acid phos was not for dengue, acid phos for symptomatic presentation, whatever my assistants are writing. So see, whenever there is a fever spike, or I had a case where the patient told me, doctor, my son gets fever and in no time the fever goes to 102, 103. Then I have to give him crocin or I have to give him that, you know, ठंडे पानी की पट्टी रखना पड़ता है, fever comes down. In 2 days, I have given the patient 6 crocin. The patient came to me. I just prescribed 3 doses of Aconite 200, 2 hourly 3 doses. After that, no spike of fever. So, what is the presenting syphilitic symptoms if you get? Very, very important. Disha, yeah, when fever subsides, the child is very, yeah, so you can just think, doctor, it is an inflammatory fever. You have to choose between two medicines. Either it is Aconite, I would give 1 mg potency in water, or if it is ferrum phos, start with LM0/7 1 hourly and the patient would be better. But whatever our experience is there, Dr. Disha, in this case the fever would be better, but still the patient would have some symptoms because this is a generalized symptom of fever, what we get the pattern, but there are some symptoms still you have to take care of. Of late, there are a lot of viral cases where I found that when the symptom changes, automatically you have to change the remedy. Sometimes what happens, the one remedy does not work totally and it is very difficult to prescribe. There are maze of symptoms. For example, I had a case where the patient was pulsatilla. I thought pulsatilla would cure the case. Pulsatilla treated only 3-4 symptoms and the fever again came back. Then I changed the remedy. I give the patient Amoncarb and now the patient is much, much better. So it depends on the presenting symptom. At least treat that first. Automatically the patient will show you some other symptoms and then treat that. Okay. Sir, my daughter 9 years old having nasal polyp. Please tell medicine. See, Mohammed, there are a lot of medicines for nasal polyp, and what happens in polyp, there are a few symptoms which are very, very common. Stuffing of the nose, obstruction of the nose, the patient cannot breathe, there is snoring also. I'll just give you some medicines which are very commonly used. Okay, then you have to repetize or take other symptoms also. For example, for nasal polyp, we have Calcarea iode, we have Calcarea phos, we have Calcarea carb, we have sulfur, we have Teucrium marum verum, we have Lemna minor, we have Thuja, we have Kali-nitricum, nitric acid, a lot of medicines. Depending on the symptom, then you can prescribe. For example, I had a case where the patient had nasal polyp and especially in the night there was a lot of obstruction, the patient could not breathe. I gave the patient Teucrium marum verum which only relieved few symptoms but did not cure the case. Then I prescribed the patient Kali-nitricum and the patient is much, much better now. Common symptoms don't help in selection of the medicine. Yes, because I had a case where the patient was suffering from epilepsy for the past 14 years, was on about 5 to 6 anti-epileptic medicine. So the patient came to me for drowsiness, for loss of appetite, for a slurred speech, gait not proper. And I told my assistant, basically these are the symptoms of the medicine and not of the patient. Then we took the medicine of the patient and then after the medicine, the patient comes to us, no attacks for 3 months now. So you have to differentiate between what are the common symptoms of the disease, common symptom created by the medicine, and then what are the patient symptoms. That's what Hahnemann says, no, deviation from the state of health. That is the process we have to think about. So don't prescribe on common symptoms of the patient. It will only relieve the symptom till you give the medicine. So what happens in these cases? You try to increase potency, 30 potency, then 200 potency, and then 1 mg potency, then 10 mg potency. Only the symptom will be relieved. The symptom will keep coming back. So symptoms of the patient which are very uncommon, that is very important. Okay. Sometimes I speak fast because there are a lot of questions waiting, but don't worry, I will just go forward. So I was telling something about polyp also. Sometimes what happens, the polyp, there was one case where the patient was suffering from polyp and it used to bleed. The patient used to put his finger in the nose with the handkerchief, it start bleeding. So the doctor said the polyp is very vascular. So we diagnosed as the polyp which bleeds easily. In that case, adding one more symptom, we prescribe the patient Sanguinaria can. Sanguinaria canadensis is 30, 3 times a day in the first day, then after some time 200, and the patient is now much, much better. So this is how we have to differentiate symptoms in cases of disease process like polyp and all. I hope you understand that. Hello, are you with me, everyone? Hello? So if you understand, just keep writing that you are understanding, otherwise I cannot understand that whether the questions are basically properly answered or you still require some more. If you still require some more, you can definitely ask me. I would be very happy to share my experience with you. Yeah, Tony, thank you so much. Understand, yes. So let us go forward. Now, somebody had written me that Sir, Sanguinary is a very good medicine for headache and migraine headache. Of course, see, all medicines are very good. Sanguinary can is also a very good medicine for migraine, especially right-sided. Not denying that, but there are other symptoms of sanguinary that you have to take care of. For example, sanguinary patient would have fantastic symptoms like neuralgia of the face ameliorated by kneeling down and pressing the head against the floor. So much pain. So I had a case of right-sided trigeminal neuralgia. The patient was on gabapentin and a lot of medication was not better with that. He told me, sir, I have so much pain sometimes in the face that I have to kneel down and press the face. Then I feel better. This is the exact line which is written in Sanguinary can in Allen's keynote. The same symptom the patient was telling. So I just prescribed on the symptom which the patient told me. Sanguinary can 1 m. After I think 2 months I prescribed 10 m in water and the patient is 90% better with trigeminal neuralgia. A very painful condition. Now he has stopped all allopathy medicine and only Sanguinary can has treated and 90% is better. So this is the importance of understanding and waiting for the patient to tell some symptom. Sometimes the patient tells you the symptom exactly written in the books. Of course, you have to know that this symptom is written in some books. That's why keep studying, keep reading mathematics every day. Don't try to mug up symptom. Don't try to remember the symptom. Let it come, let it go, let it come, let it go. It's your computer. So whenever the patient comes and tells you, you think, okay, I have heard this symptom. Go back to your memory, just turn the pages and you will get the remedy. It has happened in so many cases in my practice that the patient will tell you the exact symptom written in a Mater Medica, the exact rubric written in a Mater Medica. Automatically, for example, automatically you can get the symptom. For example, I'll just show you one. I'll just tell you one case. The same case of nasal polyp. So this patient came to me and the patient told that when my son is breathing, sir, it is when there is mucus in the chest. No, the breathing is like there is a lot of rattling in the chest. In the same way, my son is breathing. I feel there is rattling of mucus in the nose, and I was very much surprised that how the rattling of mucus was there in the nose. And I got in the repertory and there were 2 remedies. I prescribed the patient ammonium carb and the patient was much better. Sir, how can one symptom kill that? No. I am telling you, whenever there is syphilitic symptom, Sanguinary can just hear me what I am telling you, then ask the question. This is a syphilitic symptom and the pain is so much the patient kneels down, puts the head on the floor and is better with that. There is so much pain. That is syphilitic. So one syphilitic symptom or 2 syphilitic symptoms, if you get in a case, that is sufficient to prescribe. Of course, I prescribe in that way. The whole summary of the case, 1 or 2 rubrics or 3 rubrics, depending on the miasm. Those doctors who have attended my seminars or my workshop in Germany, I think Tony is there, they will tell you. Sometimes, I had a case of migraine, the whole history of migraine, we prescribe the patient single dose Epismel. So sometimes the whole case comes in that one symptom or one rubric and then that's the remedy. So the same symptom I took for the nasal polyp, rattling in the nose, and ammonium carb cured the case. Okay. Dr. Jyoti, good afternoon. Okay, so I hope Inquisit, who is the doctor is there, I hope you understood that. See, trusting on medicine, that depends on person to person, how you look at the Mater Medica, how you look at the symptom, that depends upon you. For me, first comes miasm. If that symptoms matches the miasm of the case, for example, I have a lot of cases of cancer, I had a case of cancer of mouth, which is now much better with the treatment. Of course, I took the whole case, the patient is much better. That depends on the syphilitic symptom, what is there in the remedy. If you prescribe on anxiety, sadness, anger, timidity, extrovert, introvert. These are all soric symptoms of case. In those, the remedy might fail. But if you're prescribing on the miasm of that case, then the chances of hitting the hitting the bullseye, chances of hitting the simulum are very very high. Okay, I hope you understood what I meant to tell you, everybody. Foundation media high, yes. So I hope you understood something. What I want to tell you, what I want to tell you today is that I am more of a clinician, but when you become a clinician, you have already read some of the Mater Medica or Organon or Repertory. Then you are able to understand the patient as a whole and then prescribe according to the rubrics. That is very very important. So let us go forward. So I hope you understood something about the rattling of the nose, same as rattling in the chest. Whenever the word rattling comes, the first remedy we think about is Entim-Tart. But rattling of the nose, my dear friend, very very important remedy, ammonium carb. I have prescribed in 3 cases in my life ammonium carb, and I have got fantastic results with that. Okay, so let us go forward. Any more questions? Those have scrolled up. I think you can write down again. Otherwise, sometimes these questions get scrolled up, so it is difficult for me to understand. 1M potency is given in water. No, sometimes if I want to repeat 1M potency, I will not repeat 1M potency 3 times a day. I will tell the patient to take 4 pills of 1M potency, put in half cup of water, take 1 spoon today, next spoon next day, and the next spoon next day, or 1 spoon in the morning and 1 spoon in the night. That is divided doses. So I'll not repeat that potency. Okay, that's how I prescribe. So let us go forward. I hope the answer of polyp is taken care of. Now there are cases. What happens? There was a case where the patient used to come and tell me, sir, the case was of chronic renal failure, and the patient was so worried. The creatinine count was 7.2, if I'm not wrong, and the patient had one symptom which was very 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 interesting. The patient told me that whenever there is something cooking in my kitchen, I go out of my house or go in the other room, because I can smell what is there, I can smell what is cooking, and I don't like the smell. I can smell everything, and I can tell my maid that, yeah, today dal has been cooked, today the chicken has been cooking. The smell was so acute. The smell was so acute. So I added few symptoms in that case and prescribed the patient China. The patient is still with me. His creatinine count from 7.2 has come down to 3.6. He's still on China LM potency. So this is the importance of syphilitic symptom. You understand a particular thing in a mode out of the control. The smell was out of control. You could smell something after at a distance also. So take the rubric, smell acute. I had a case where the smell was so acute, the patient used to feel that as if I am smelling a dead body, and that patient was of migraine. If you go to the repertory and see smell like a corpse, and the remedy is belladonna. In fact, it is China also. So that case was given belladonna, and the patient is much much better. So this is the importance of understanding syphilitic symptom. Okay. Good afternoon, sir. Lady after blood transfusion has symptoms of blackening of face and axilla region. Please guide. Yeah. So, Dr. Manoj, there are some cases where in blood transfusion there is an accumulation of iron, and that's why doctors give some tablets so that the iron load is minimized in the body. And because of accumulation of iron, there is tanning of the skin. In this case, in these type of cases, I have got very good results with prescribing ferrum for 6-section trichulation. Ferrum for 6-section trichulation, I have got good results. So you can try that. Or sometimes ferrum metallicum also works in infrequent doses in LM potency. Odor was acute in renal case? No, it was a case of, okay, sorry, this is my answer by my assistant. LM potency given directly or always dissolved in water? No. I prescribe directly also 10 strokes, and after that just take out and take 1 spoon. It is approximately 5 ml. You can give directly also. That I give directly in some cases. If I want to give in divided doses, then I tell the patient 10 strokes, then take 1 spoon, that put in half cup of water, and then from that water take 1 spoon. I give that also, but normally sometimes it is very cumbersome, so I tell the patient to take the water directly. I do that. Okay. I have treated a case of diabetes whose fasting was 205 after 25 days KD5 with only. Very nice. And Dr. Sara, that's very nice. And thank you for sharing your experience. This is how we can grow in our practice, and treating diabetes is a very interesting thing. So let us go forward. So I hope you understand something about the smell. I had a very interesting case. Yeah, walaikum assalam. I had a very interesting case. I had a case where the patient used to say that I smell musk. Whenever I go, I feel that there is a smell of musk. The patient was not better with any medicine. I also did not take this acuteness of smell for my prescription. But then nothing was working, so I prescribed. The patient came to me for loss of memory, and he was 68 years of age. He had loss of memory, could not remember a lot of things and all. Always used to tell me that I smell musk. So then ultimately I went to that rubric, and I had a rubric, smell of musk. I prescribed the patient Agnus castus. If you have seen Agnus castus, I had told you before also. Agnus cast has a very, very interesting symptom in our Mater Medica. Not only related to sex, of course, there are a lot of symptoms of sexual thing, but Agnus cast has a fantastic symptom. If you read Allen's keynote, the first line: absent-minded, reduced power of insight, cannot recollect, has to read a sentence twice before he can comprehend. And this smell of musk. What a wonderful combination. I repertorized this case. I got the smell of musk, Agnus cast. I heard this symptom of loss of memory was there in Agnus cast. History had that sexual history. Agnus cast is doing wonderfully for this case. He is getting his memory now, he can remember, and the case has improved tremendously with Agnus castus. Okay, so this is how you have to basically understand the patient and prescribe. Of course, prescribing is always because of case taking, repertorization, miasm, and then prescribe the similar. Okay, hello, are you with me, everyone? Everyone. Agnus cast, I know, are an important remedy for sexual complaints, but there are some symptoms in Agnus cast which you must take note of. One is this memory symptom, and one symptom of leukorrhea. Very, very important. Leukorrhea after frequent attacks of gonorrhea. And the leukorrhea quality, the character is important. It is transparent, staining the linen yellow. This is very, very important symptom of Agnus castus. If you go forward also in Agnus cast, one symptom I would like to share: deficient secretion or suppression of milk in nursing woman. It is a very, very important symptom of Agnus cast, and because of this, the mental picture is the patient is very sad because of that. The patient feels very sad because of this. That is Agnus castus. This is the importance of reading Mater Medica every day, my dear friends. Okay? Please ask, are you with me, everyone? Understanding this? Just share at least tell me that you are understanding, so I know that I am speaking otherwise I am speaking to the computer, Yeah. And there are a lot of persons, doctors online. You can always share. Yeah. Sunrise Melody. Okay. So let us go for Agnus cast. Very. In fact, if you see Agnus cast in Mater Medica also, in Allen's keynote also, if you have Allen's keynote, if you open Allen's keynote, it is written, complaints of imaginary odor before the nose, as of hearing or musk. So important. If you don't repertorize the case, sometimes just the understanding and the reading of Mater Medica will help you to prescribe the medicines, my dear friends. The memory symptom and the musk symptoms both are present in Allen's keynote. If you open Allen's keynote, Mater Medica, this is the importance of understanding. This is the importance of reading Mater Medica every day. You read any book. Don't ask me what book. You read any book, because in college life I had read Allen's keynote too many times, so that becomes my favorite book. It is not like that. Whichever book you read at least one remedy every day, and you will be surprised that after 1 year your knowledge has been added with so many other symptoms of Mater Medica. Okay, so please tell remedy for leukorrhea amulets before commencing menses. Lot of remedies. You can take pulsatilla, ammonium carplatina, sulfur, lycopodium. Lot of remedies. Kindly help with medication of ED due lack of. No. Lack of confidence is a condition where the patient develops because of some problem. Nobody is born with lack of confidence. So take the whole case properly. That is very, very important. Okay. Yeah. So I hope you understood something today. I think you will get something, and you have taken some knowledge and applying your practice. Okay. So it is already half an hour up. Thank you for joining me, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Thank you so much. Thank you, Doctor. Thank you, Tony. Thank you.